Thank you everyone for joining us today for today's webinar on improving outcomes for young children experiencing homelessness, connecting homeless housing providers to high quality early learning programs. Today we have Tracy Durate, Joe Willard, Sarah Verbeck, and Andrea Sheasley. Tracy has served as the director of the PA Head Start State Collaboration Office for the past 5 years. Prior to that, she was an early Head Start director in Venango County for 12 years and worked as the PA Infant Toddler Specialist for 0 to 3. Tracy is a member of the National Association for the Education of Homeless Children and Youth Early Childhood Committee, the Head Start Collaboration Learning Community on Homelessness, and serves as the co-chair of the PA Homelessness Task Force with Joe Willard. Tracy received her bachelor's degree in psychology from the University of Fendale in Ohio. Joe Willard is the Vice President for Policy at People's Emergency Center. In this role, he supervises all policy and research at PEC. He co-chairs the PA Homeless Stakeholders with Tracy Durate. In addition, he co-chairs Family Service Provider Network, the PA Homeless Youth Network, and the Children's Work Group Early Childhood Committee. He plays an active role in HAPM, the National Network on Family Homelessness, Schoolhouse Connection, and others. He is the former chair of the Philadelphia COC Advisory Committee and member to the Philadelphia COC Board of Directors and PA Task Force on Homelessness. Prior to joining PEC, Mr. Willard was an associate manager for public policy at the United Way of Southeastern Pennsylvania for 4 years and an associate director at the Reinvestment Fund's Regional Workforce Partnership for 4 years. He earned his master's degree from Hunter College and his bachelor's degree from Penn State University. Sarah Verbeck is an early childhood education specialist with the Building Early Links for Learning Bell Project at People's Emergency Center. She received her bachelor's and master's degrees in psychology from Villanova University and has been working with families experiencing homelessness in Philadelphia for the past 5 years. Andrea Sheasley graduated from Indiana University of Pennsylvania with a bachelor's degree in child development, family relations, with minors in psychology and sociology. She has been employed with the Armstrong, Indiana Intermediate Unit for 23 years. Andrea worked with the Family Literacy Program, teaching parent education and early childhood education, then with the Indiana County Family Center as the lead family specialist, again working with families as a parent and early childhood educator. For the past 13 years, Andrea has been the Regional Homeless Coordinator working with the school district and homeless shelters, supporting the needs of children with their education needs while experiencing homelessness and their families throughout Region Number 6 with the Education for Children and Youth Experiencing Homelessness program. Andrea also serves on the Cambria County Community Action Agency Board, Head Start Policy Councils, local interagency coordinating councils, early care and education committees, human resource committees, and local housing boards throughout Region Number 6. Thank you again for all for joining us, and I'm going to turn the presentation over to Tracy.
Good afternoon. This is Tracy Duarte, and again, I'd like to welcome everyone on the call today. Today, myself and my colleagues are going to share some information with you on the impact of children experiencing homelessness. Joe Willard will also share some specific data to the Philadelphia area. We're going to provide information specifically to the housing and homeless community on all of the requirements for serving homeless families in the Head Start performance standards. We're going to explore ways for the housing community to partner with their local Head Start and early Head Start programs, as well as other early childhood programs in order to better serve children and families experiencing homelessness. And finally, we will share some really valuable national and state online resources with the group. So again, I'm Tracy Duarte with the Head Start Collaboration Office. We have Joe Willard, Sarah Verbeck, and Andrea Sheasley with us, who will be helping with the webinar today. Joe, I'll let you go ahead.
All right, thank you, Tracy. This is Joe Willard, and thanks everybody for hopping on board today. So why are we even focusing on children who are experiencing homelessness and all? What is our role in this? What is HUD's expectation? What are the expectations from the early learning community? We focus on young children because we care about young children. Yes, the homeless housing system is supposed to find housing and stick to that one focus, but in the meantime, we have children staring up at us. Many of us try to address the multiple needs of our families, and that includes children's needs. As you can see on the screen, there's a lot of research that's been ongoing for the last 30, 40, 50 years, informing us how young children are experiencing homelessness and some of the challenges that they're facing. So we know from this research that homelessness impacts young children. Let me say, though, that not all homeless children have negative effects. Many are very resilient. They have resilient factors in their lives. They have loving parents, supportive siblings. They have a grandmom who provides what is needed and gets them the things that they need. But many children don't have those supportive factors in their lives and all. And homelessness may be just one of many negative factors, as you can see that's on the screen here. So, but we know from local data that homelessness harms performance. This is a shot of some data from the Department of Education here in Pennsylvania, looking at the reading scores from the PSSAs and the other standardized testing, comparing homeless kids to their peers. I'll point out that if you look at the below basic, 29.6% of homeless children are scoring at the below basic, almost 2.5 times more than their peers. And conversely, up in the advanced level, only 5% compared to 17% of the peers are scoring at the advanced level. This screen shows the math scores. Previous one was on the reading. And again, if you look at the below basic scores, it's 26% are actually scoring from all kids are scoring at that level, where it's almost double of the homeless kids' experiences. And we know if kids start scoring at such poor levels at the third grade level, that's going to speak volumes about what they're going to be doing when they hit 8th grade. And there's some research indicating that kids scoring at such a low level are not going to graduate on time in high school, among other things out there. Why support? Because it's very complex that the families face and the children face and all. Many homeless children are dealing with multiple systems: the child welfare system, the housing system, the school district, the healthcare system. Many of them have multiple case managers who may not be talking to one another. Many of them have demands on their time and schedule and are telling parents to go this way and that. And so it's very difficult when working with families to really get them everything that they need, just because it's when you're in a shelter or you're living in a tent in a park somewhere, it's difficult to manage the relationships out there. So one of the reasons why we really need support, particularly we from the homeless housing system, we have to understand that there's so many demands on young children, and we need to do everything possible to help get them the services there. This kind of shows you the scale of what we're talking about. For the first time ever, these Pennsylvania Department of Education identified more than 30,000 children and youth who experience homelessness throughout the state. As you can see, the numbers are going up. Many of us are actually saying that because the school districts are doing a much better job of identifying and supporting students, that's one of the reasons why homelessness seems to be going up, in spite of the fact that we have a great economy going on and we have very low unemployment. The numbers of kids keep still going up. When you look at the scale of children ages 0 to 5, you can see how it's broken out through the 8 regions that the Department of Education uses to organize and manage and deliver homeless education services and all. We can get you a map of where these regions are if you're interested in, and this information comes from a report we summarized from the Department of Education, and we can get that to you too if you're interested and all. And the final note on why supporting young children, the highest odds, if a human being in the United States today is going to become homeless, the highest odds of them becoming homeless is between the ages of 0 and 12 months. That is the highest probability of someone in Pennsylvania becoming homeless and all. And this data is both on a national as well as it's echoed. We looked at this data in Philadelphia, and it was almost point by point. It was accurate. So the most homeless folks that are out there, they tend to be young kids and all. And that doesn't seem to be abating. It seems to be going forward and increasing almost on an annual basis and all. So in sum, I think the reasons for supporting are A, it's a growing challenge. B, kids need to get started on the right path. The Department of Education and a lot of local city school districts and other entities are focused on increasing high school graduation rates and helping children perform better. But if they're not, as I think probably everyone on the phone knows, if children don't start off on the right way, there's going to be challenges in their development as they move forward. The research backs that up. The biggest brain development occurs in the first handful of years, and that's the opportunity to really set them straight and all. And this is just one slide of dozens and dozens of research that's out there showing that the opportunities for helping children have healthy development start from day one, and actually before. Is there any evidence-based interventions for helping young children 0 to 5? There's not much, but there is a lot of data from the last 40, 50 years showing that it's the best investment possible is by getting young children into high-quality early learning programs. The left-hand chart is the very famous Heckman equation chart comparing early intervention with a lot of other social service programs at different ages for people, and the biggest bang for the buck is those programs serving 0 to 5. And on the right-hand side, you can see 3 different programs and what their cost-benefit ratio was, again, over a long period of time. And this data really helped both the Republicans and Democrats agree that they need to increase investments into high-quality early learning programs for all children. And if it's good for all children, it's certainly good for homeless young children. And that's one of the best reasons why of trying to increase access for young children who are experiencing homelessness into high-quality early learning programs. And perhaps the last good reason is that it's now policy. Thanks to the U.S. Interagency Council on Homelessness and a lot of advocates from throughout the country, the federal entities that pay for child care, the Head Start program, as well as the U.S. Department of Education through McKinney-Vento, it's in our policy that we really need to come together and focus on how to support young children who are experiencing homelessness. In 2016, a collaboration between HUD, Education, and ACF, the Administration for Children and Families, came out with a policy statement giving a host of things that the local states and local regions can be doing to support young children who experience homelessness and all. So now it's embedded into our policies. For those folks with experience in a continuum of care, you know that in the application we now are eligible to get a point to the scoring mechanism to be awarded federal funding if we are able to demonstrate that the local continuum of care is doing something to reach out and expand access for high-quality early learning programs for young children. And finally, before I turn it over, just want a quick summary of the homeless definition to make sure everyone's on the same page. You know, as everyone on this phone knows, there's 2 definitions. Education has one, and HUD has another and all. And so what we're talking about today mostly is expanding access for high-quality early learners for all children, including those who are doubled up, as you can see, and also those are other categories on the screen, and also for migratory children is in our purview. So that's who we'll be mostly talking about today. And I think that concludes my slides. Let me turn it over to Sarah Vrabrick, who's an ECE specialist with the Bell Project. Sarah?
Hi, everyone. Thank you for coming. So today I'm going to discuss the Building Early Links for Learning, or BELL project, here in Philadelphia. I'll be talking about kind of how the project was conceptualized, what our main objectives are, and then the activities we've been doing recently to really connect the housing world with the early childhood education world so that we can develop these protective factors within the lives of children experiencing homelessness. So the Bell Project really started at the beginning of 2016. It was a collaboration among the multiple entities you can see on your screen. So, you know, the Office of Supportive Housing in Philadelphia, People's Emergency Center. We had some national partners like the Administration for Children and Families. And we were funded by the William Penn Foundation. And our primary goal was to increase the developmental friendliness of housing program environments and to really get our housing partners to understand why early childhood education can be a valuable asset within the lives of young children experiencing homelessness. So we did that through performing the self-assessment with housing staff, and we were able to fund mini grants for each program to fund improvements to their environment to make them more developmentally appropriate. And then that was also a way to share resources with housing staff and to figure out how we could best support them getting access for their families to high-quality ECE programs. And I should mention that in Philadelphia we have 18 city-contracted family shelters. So that's who our primary partners were. Based on the initial phase of the project, we collected information for each child aged 3 to 5 in shelter, whether or not they were enrolled into an early childhood education program. We did that at the beginning of the project, and then at sort of the finishing phase of the project about 18 months later. And because of our self-assessment efforts, and also just because we were able to discuss and put into the atmosphere the importance of high-quality ECE, we tracked a 24.5% proportional increase of enrollment for preschoolers into early childhood education. So based on that success, we were able to get a new phase of the project funded by Vanguard, and it's now allowing us to delve even deeper to establish more goals and to really work side by side with our partners in the enrollment phase for children. So this year, 2018, kicked off the new phase of BELL. It's a 3-year project now in its current state, and our 2 primary goals are on the screen. We want to increase the enrollment of children aged birth through 5 experiencing homelessness into high-quality ECE programs, and carrying through from the initial phase of the project, increase the developmental friendliness of our housing partner environments. So we will accomplish these primary goals in a number of ways. I am listing out the objectives for the project. So one of these ways is to work closely with the staff at each of the shelters, so that we can really figure out the needs of each family. You know, all shelters are different, so we want to maintain our relationships with the staff there. We are building connections to the local high-quality ECEs around each shelter. So, you know, we're letting them know if the shelter is comfortable, that they have a shelter within their vicinity, that their kids are in need of high-quality education, and really being that, you know, handshake between the 2 vicinities. We are also doing parent education, engaging families, figuring out what their needs are in terms of applying for subsidy, in terms of if their children have any special needs. And then also, we really want to provide resources to them so they know what high-quality early education looks like, so that in the future, they're able to, they feel empowered to do this themselves. They understand what's important for their child, and they can provide for their child that high-quality education. We established the developmental sensitivity through cross-system understanding. So the self-assessment, which I think will be discussed a little later in the presentation, that environmental assessment really helps us to know the status of each shelter in terms of their developmental friendliness. And then through that process, we're able to have a local ECE partner sit in with shelter staff in their program and really discuss and flesh out how they could improve their space so it's more developmentally friendly. Because I believe the average length of stay in Philadelphia for families is about 5 months.
5 months, yeah.
Yeah, about 5 months. And, that might not seem like a long time in the scheme of things, but for an infant, so much development happens in that space. So if we can connect them to a high-quality program and then also have the shelter where they stay, at night and in the afternoons, if they both can be these developmentally friendly environments, well, then we're really setting that infant up for, increased health despite their current experience of homelessness. We also, we're collecting data and establishing a community advisory board, which I think Tracy will discuss later. So it's just, we're hitting it at all angles. Not only are we working directly with families in shelter, but we're working with shelter staff, we're working with ECE staff, and then we're also targeting state agencies so that we can set these families up for success at all areas. So in order to carry out these objectives, we have a wonderful team that we were able to hire. So I just wanted to highlight the awesome team. We have our ECE specialists going from left to right, Dawn Knock, Aisha Weaver, our project director, Rosalind Edwards, is kind of in the middle there, and then me, Sarah, I'm on the right. So how we initially kicked off the project at the beginning of this year was just orienting ourselves and our goals to each of the 18 housing agencies that serve families in Philadelphia. So here's just some photos of when we were doing that. We also toured and met the early child care programs around these agencies, really just putting a face to a name, a face to a goal, and showing that we're in this, we care, and we want to be that technical support for establishing these relationships and connections. How we approached it sort of at the level above each of these facilities is meeting with providers, with the directors that oversee a lot of the agencies within the city of Philadelphia. And also, we've been very grateful to have Child Care Information Services, CCIS, become a really valuable partner to us. And I'll just say that, case by case with certain families, the relationships we've been able to establish with them have secured childcare for a lot of our families. So that's been invaluable throughout this year. So now I'll just get into some concrete ways we have established and maintained these connections. We have developed meet and greets, which are conducted on a quarterly basis. And it's basically, we bring together staff from housing agencies, staff from early child care agencies, and we have lunch. It's really just an hour-long event. We group people by region so that they can really get to know who's in their neighborhood and how they can best serve the other. And we also share resources during these events. So it's not only meeting and greeting, but for instance, our last event had a developmental psychologist about sensitivity and how we can best communicate with families who might be experiencing trauma or chronic stress, how we can best communicate with them from the housing perspective and from an education perspective. And staff from both of those worlds were able to discuss and learn different techniques together. And it was met with wonderful feedback that they were able to better understand that other side because they were learning something together and understanding the other person's challenges and maybe even offering solutions to those challenges. So we really try to create that precedent for each of these events, and it just helps to maintain the relationships, like I was saying. We have started conducting enrollment drives that are organized directly in shelter. So at our last enrollment drive, we had representatives from CCIS, from the School District of Philadelphia, and from high-quality ECEs that were within walking distance of that shelter. They all came in and set up tables. We offered parents resources and had an informal discussion with them about good questions to ask the program when you're looking to enroll your child, so that when they went to each table, they felt empowered on the kinds of questions and conversations they could have with those representatives. And then we also got books donated, which was really fun because each family could then shop around and take home a couple of books after the event. And we had at least 10 early Head Start referrals because of that event. Families were able to get their subsidy questions answered, and it was just a really great way to bring the world of education inside of the shelter, and we are going to continue that model in the future. Through our self-assessment and focus groups we've conducted, so we've conducted focus groups with housing staff and early childhood education program staff on what trainings they would like, and we've been able to set up a training calendar through mid-2019, basically using their direct feedback so that we can offer the services that they need most. And I will say that we're able to do that because of the relationships we have maintained. Because we, were able to connect with CHOP for a different event, we're now able to ask them to conduct a training on allergies and allergic reactions and how you can recognize that in the future. And that wouldn't be possible if we didn't make an effort to just be present in the community and have these relationships. And I also want to highlight the Children's Work Group Early Childhood Committee that started around 10 years ago. Joe Willard started around 10 years ago. So Bell cannot really claim that as a success, but I will say it helps Bell thrive today, and it's really a model that we try to live by. The Children's Work Group once a month brings together housing staff and ECE staff and education lawyers and CCIS and Children's Crisis Treatment Center and all of these programs throughout the city that wouldn't otherwise be in the same place, but that all tend to deal with young children in at-risk environments. It brings them all together so that they can not only discuss current state of affairs and try to problem solve issues that might be happening within the city, but also to share resources and to have that direct contact with other entities so that these families, like I said, can have the best opportunity for success possible. And because of that work group, we were able to make many connections throughout the city to really best meet the needs of our families served. So those are some concrete activities we've been working on, and we can't wait to continue them in the future. And we're really excited that because of this new phase of Bell, we can dig even deeper to really be the connection and that partner and handshake between the education and housing world. So that is all I have. I believe Tracy?
Yes. Hi, this is Tracy Duarte again. I'm just going to talk through some specific strategies for Head Start and other early learning programs to collaborate with their housing and homeless provider partners in local areas. I'll do that in the beginning. by talking through some of the Head Start performance standards. But basically, the reason we're going to focus more on Head Start today than other early learning providers is because really Head Start is a perfect match to serve our children and families that are experiencing homelessness, because Head Start does provide comprehensive services that children may not otherwise receive, especially those who are experiencing homelessness. The Head Start focuses on the entire family and provides really a number of additional supports to the parents and extended families, meaning it could be grandparents raising grandchildren, foster parents, etc. Head Start also focuses on community partnerships that again puts Head Start in an excellent position to work with all of the agencies that are serving children and families experiencing homelessness. And finally, Head Start programs are required to identify and prioritize homeless children for enrollment. So this allows those children to enroll in the program and not necessarily have to immediately worry about required paperwork. And also, Head Starts are required to coordinate with other community agencies, including the LEA liaisons. So briefly, Head Start and Early Head Start, for those of you who may be new to this or not familiar, it is free to eligible children. Early Head Start serves pregnant women and children ages birth to 3, both in home-based programs where they have a home visitor, as well as center-based programs. Head Start serves children ages 3 to 5. Most are center-based, but there are some home-based that serve this age group, as well as some local combination options, and family Head Start, family-based programs. In order to be eligible for Head Start, a family must meet income guidelines, which is 100% of the federal poverty guidelines. Children must be age eligible. So again, for Early Head Start, that means a pregnant woman or child to age 3, and for Head Start, age 3 to 5. There are some circumstances where a child will be automatically eligible, such as children experiencing homelessness and children in foster care. When I talk about Head Start services being comprehensive, that means children have high-quality teaching and learning opportunities. Head Start looks at things like health and nutrition and safety, mental health, and it also engages parents, the entire family, as I mentioned, the community, and Head Start also has a very unique piece that we refer to as shared governance, and by that I mean there's a governing board as well as a policy council, and that policy council is made up of 51% parents. So parents really have a true say in the policies and procedures of a Head Start program, as well as major decisions that are made. Okay, so briefly, when a Head Start program does the required community assessment, they are required to collaborate with McKinney-Vento liaisons, as well as others in other programs and services that provide services to children 0 to 5 in their local communities. So this is one way of many where local programs can partner with Head Start and assist them in gathering data for their community assessment. Something that often is not understood with Head Start programs is that while they are to verify that a family is homeless, they do not have to have anything in writing from any provider in the local area. They can, if it's available, have some documentation from a local provider that states, yes, in fact, they are homeless, but that is certainly not required. Any anecdotal notes that are obtained through an interview with staff can establish that that child is, for purposes of Head Start, homeless. Also, programs must specifically reach out and actively locate and recruit children with disabilities, as well as other vulnerable children, which includes homeless children and children in foster care. So another way for local Head Start programs to collaborate is to reach out to their homeless education and housing providers to find out exactly the number of estimated homeless children and families are living in that community and where exactly they can find them. Head Start has to establish selection criteria, and they determine who the next child to be enrolled in the program is based on that selection criteria or prioritization. That means that children do not enter from the wait list based on the length of time that they've been on the wait list. Rather, they enter based on their risk factor, as Head Start is required to serve the children that are most vulnerable. One thing that Head Starts are able to do per the new performance standards is reserve 3% of their enrollment at the beginning of the school year and throughout the school year for children experiencing homelessness. This is rather complicated for Head Starts to do. It requires really putting in place policies and procedures around this process, but it is certainly possible. And if Head Start programs are interested in doing that, then they will work closely with their housing and homeless providers locally to ensure that they are getting the referrals so that they can fill those slots as they are left vacant specifically to serve this population of children. Programs must comply with all state immunization requirements except with homeless children, and if a child experiencing homelessness is unable to attend any classes due to transportation, they must attempt to find transportation through other community resources for that child. Also, children are allowed to go up to 90 days based on the state regulations without having their immunizations on file if they are experiencing homelessness. And again, I want to just highlight that it is a requirement that programs must establish, Head Start programs must establish collaborative relationships and partnerships with community organizations, specifically those organizations serving families experiencing homelessness, including the McKinney-Vento liaisons. And also Head Start programs and early Head Start programs are required to assist families when they're moving out of a community and transitioning between programs. If there is not a program available, they're asked to assist the family to either continue to serve them or find other programs where they've transitioned to meet their needs. Okay, so if you are a housing or homeless services provider and you are interested in reaching out to your Head Start or early Head Start programs in your local community, excuse me, this is the best way to do that. So on the Pennsylvania Head Start Association website, which I have here, and this is a hyperlink, so when you receive the webinar slides, all of these will be made available to you. If you go on to the Pennsylvania Head Start website, you'll see in the top right corner this Head Start program information. Click on that. It will take you to this map on the right. Find the county or where your services are or where you're looking for a Head Start program. Click on that county, and it will open up to a list of all Head Start and early Head Start programs in that county, as well as contact information. So that is certainly the easiest way to locate a Head Start or early Head Start program. Should you have any trouble, however, you are always welcome to contact me, and my contact information, my email is here, and it's also at the end of the presentation. So there are other early learning programs, of course, available in Pennsylvania. We highlight Head Start because we believe that it is, because of its comprehensiveness, the program that's most able to serve children experiencing homelessness. However, there is also a pre-K counts offered in Pennsylvania. As you can see here, I've listed some of the eligibility requirements. If you are looking for more information about Pennsylvania pre-K counts, you can go to the Pennsylvania Key website, which is listed, or you can use Compass, Pennsylvania Compass provider search, and this link will take you to that. We also in Pennsylvania, of course, have child care and Child Care Works, which is the subsidy program for child care. All of our child cares in Pennsylvania have the option to be, and actually they're all in our STARS program right now. So that is our quality rating system, and it rates each child care program based on their quality up to a 4-star. You can find the child care programs again in your local area by accessing the Pennsylvania Compass site, their provider search. More information can be found on the Pennsylvania Key website. We also, in Pennsylvania, just beginning July 1, opened the doors to our new system of early learning resource centers. They are spread all throughout the state, and more information on those early learning resource centers can be found at raiseyourstar.org or the Pennsylvania Key website. And I encourage you to, if you are not familiar with early learning in Pennsylvania, I certainly encourage you to go explore all of those websites. All right, and now Andrea Sheasley will talk to you a little bit more about the things that are happening in Pennsylvania in terms of collaboration.
Thank you. Good afternoon. This is Andrea Sheasley. Today I'm just going to talk a little bit about building partnerships with our local Education for Children Experiencing Homelessness programs, early childhood programs, along with the local housing community. So what we decided to do, and I was really excited for this because of my background being in early childhood, is that I met Tracy and we got together talking about what policies were the new mandates for homeless in conjunction with Head Start programs. So we wanted to identify what was needed between the two communities. And as you had learned or already knew, that our definitions were a little bit different, and so we wanted to make sure that Head Start was following the education definition. So from there, we have started to build that partnership. Tracy and I have presented at the state level at our homeless conference, along with interagency mental health conference with mental health professionals. Currently, what the regional and site coordinators with our program are doing along with Tracy is to build a early childhood committee team to address those issues and build the gap between early childhood education and homeless education. And we're doing this by building a toolkit to assist with the collaboration of those programs. So our goal ultimately is to ensure that the professionals in the area understand what homelessness is and how to talk to families about homeless, because as we all know, families don't want to be labeled as homeless, but if we bring in they are temporarily placed, or what was your situation that made you displaced, they're more apt to talk about that and understand that we're here to all support their needs. So what did we decide to do? So Tracy and I got together to bring in our local Head Start community, along with early intervention, emergency and domestic violence shelters, teen shelters, McKinney-Vento liaison. So we had a roundtable discussion. So we invited all of those partners to a table to develop strategies to improve the services for families who are experiencing homelessness. So in the past, as we have always focused on the early childhood, education program, had always focused on the K-12. So now we are focusing the past 2 years with the pre-K program. So what we decided to do was we wanted to link those services with the shelters. So bringing in the roundtable discussions and building those programs, we learned a little bit more about what was needed in the local areas. The local Head Start programs and shelters programs learned who each other was, which was a great beginning for them. And so with those efforts, Tracy in the collaboration office is in the process of supporting those programs that attended the roundtable discussions by supporting the shelters that want to work together with their Head Start programs. As a little bit what Sarah had said, they have shelters our kids are staying at the shelters. So what can we do to help them to be more child-friendly? So I believe that we haven't done this yet, but it is in the process of having grants for those shelters and Head Starts to have shelters with books that are appropriate, toys that are appropriate, maybe making their environment safe for those children. We had interest in maybe a small playground for a shelter. So those are some of the things that we are looking at that will come out of our meeting with them. Because, like we said, shelters, the children are staying there for 30 days or more, and that is their home. So we want to make sure that their home is just as important as a shelter as it is in, a regular home. So that's what we did with that. Also, connecting with local Head Start programs is something that I have been working on, making sure that I train all the staff and learn what they are doing to bridge our communities together, discussing policies and procedures to implement through both entities. I make personal visits to every shelter along with every early childhood community to continue building and bridging that gap. Also, I offer to sit on some Head Start policy councils. And then, of course, connecting with the other pre-K programs and pre-Ks that are in school districts. And providing school districts that do not have pre-K programs a list of the programs in their area so that whenever a child is coming either that is homeless and having a sibling that is younger, that the school districts know. And we always think that they do know exactly where all of their programs are, their early childhood programs are, but sometimes they do not. So that's what we're trying to in the middle of there. Also, what we're looking at, I'm sorry, I lost my train of thought. Data collection, what we have been doing is since it's a federal law, all students that are experiencing homelessness in the school districts, every school district is entitled, is required to provide data to PDE and to myself. So what we do is I collect that data, and that's how Joe was able to show you those screens. Also, I'm partnering with Head Start. They share all their data of students that are homeless, shelters, other pre-K programs, and then, of course, any other agency that is providing services to the children and youth that are homeless. What we're really hoping is that we can get everyone on board so we have a more accurate data collection system because throughout the state, we are the different 8 regions. Region 6 is the only rural region in the state, so our data, of course, is smaller, but we know that those students are out there. So part of our goals are also to work with all of the local housing COCs to see if they would like to partner and work with us since you are having our children through your agencies, and just to make sure that all that data, all those children are collected to give it more Pennsylvania a better accurate data collection. So there's some things that we are doing. I do apologize, I should have provided our map to you, but if you go onto either PDE's website or onto the Center for Schools and Communities, you will see how we are broken down across the state and how each region, where each region lies. And again, my information is at the end of the slides, so you can also contact me, and I'd be more than happy to share who your regional contact is for your area. So
Thanks, Andrea. I actually have a link to the map in here that I can point out as I go through just a few resources. I won't go through each of these, but I will say that there are a ton of federal resources online that are available. I have highlighted on this slide, and again, the hyperlinks are all live, so when you get this, you can click right to them. But I've highlighted just some of the ones that I use the most. and that I think are hopefully will be very useful to you. One thing on this slide I really want to point out for you is this under Early Childhood Learning and Knowledge Center, the Supporting Children and Families Experiencing Homelessness modules. This is a series of excellent training modules that are available. I believe there are 7 right now. I could be wrong. It could be 8. And I really encourage you to go through each of those. You get a certificate at the end. Encourage your staff. It's an excellent free opportunity to do some training for yourselves and your staff around serving children and families experiencing homelessness. Sarah mentioned the self-assessments that they use, not only in the emergency shelters, but certainly also in supportive housing and also in early childhood programs. So these are the self-assessments. This is what the covers of each look like. They're excellent. I highly recommend each of you finding the one that is most appropriate for you, whether you're a housing or homeless provider or an early childhood education program, and go through it. I also encourage you to go through these with partners. So if you're an early childhood program, reach out to one of the homeless providers in your local area and have them come work through this with you, because they can help you to understand exactly how you can make your center more friendly, developmentally friendly and sensitive to children experiencing homelessness, and vice versa. Homeless providers, shelters, supportive housing, allow your early childhood education experts to come in and go through these with you so that they can help you make sure that your areas and facilities are developmentally appropriate and friendly to children. So again, the link is embedded in this slide for you to access those. I talk about a lot of resources being available. This particular document here, the policy statement, there's a link at the bottom. Certainly at the end of this, there are more resources probably than any of you will ever have time to go through, but I encourage you to read this. It gives very specific examples of how to collaborate and partner in your local communities. These are some state resources. So the People's Emergency Center is where Joe Willard and Sarah are out of, as well as the Bell Project. The Pennsylvania Education for Children and Youth Experiencing Homelessness, Andrea's program at the state. There's the link to the map that we referenced. The Pennsylvania Key I talked about earlier. Their website is excellent if you want to learn about early learning in Pennsylvania. I'm also in the process of building up my collaboration office page, so there will be plenty of resources on that page when it's ready around services to children and families experiencing homelessness. Pennsylvania Head Start I mentioned earlier. That's where you can locate local Head Start programs on their website. And then the Pennsylvania Homeless Assistance Program is also an excellent site for you to use. Okay, I apologize. That took us a little longer than I expected to get through, but I will open it up now, and hopefully, Colleen, you can unmute if anyone should have questions. Excuse me, while we're waiting for that, I just want to mention, I want to make sure to say that Joe and I do co-facilitate a statewide stakeholders or committee. I guess we call it a couple of different things, but Joe and I are facilitating a statewide homelessness stakeholders group, and we are very committed to working hard to support all of our programs out there that are working to support children and families experiencing homelessness. So having said that, I encourage you, if you don't get your questions answered today, if you're not comfortable asking them in the group, or if there is anything at all we can do to support you locally, please reach out to either Joe or I. And if we can't answer your question, we will certainly guide you to someone that can. And we're certainly more than willing to help you strategize ways to better collaborate and partner in your local areas. So having said that, do we have questions?
Great. So we do have a lot of people on the call today, so I'm going to encourage anybody who wants to ask a question to actually press *7 on your keypad for your phone, so that will unmute your individual line and you can ask a question. You can use the chat box feature to type in a question, but that's *7 to unmute your phone and ask a question.
All right, well, so far it sounds like we have a little bit of a quiet group today, maybe a little gun shy. Unless I hear someone come in with a question, and if you do have one, please interrupt me. I will leave you all with our email addresses, which are listed here on this slide, and I certainly encourage you to reach out to any of us with any questions or maybe a request for follow-up or more resources or information. We are certainly open to assisting all of you in any way that we can.
Great. Thank you, Tracy. And then I guess we'll just do one last call for questions. So that's *7 to unmute your phone, or you can type it in the chat box. Okay, well, if there are no questions, I want to thank Joe, Tracy, Sarah, and Andrea again for presenting for us and joining our webinar today. And I want to thank you all for attending as well. Thank you, everyone, and have a great weekend.
Thanks, everybody.
Thank you.
Thank you.